So the next thing that I'm going to do, I'm going to go ahead and perform a general survey on the patient, basically looking at their overall appearance. We're looking for the color of their skin, their respiratory effort, making sure they're in no obvious distress. We're looking for personal hygiene, their mood, their posture, any obvious physical deformities, things of that nature. Next, I'm going to perform an assessment on the skin. So I'm basically going to have the patient sit in a relaxed position. I'm looking to see that the skin is warm, it's dry, it should be intact. I'm going to check the skin turgor by gently pinching an area of the skin to make sure that there's no tenting, and then looking for good capillary refill in the extremities, making sure that there's no cyanosis. Next, I'm going to move on to the head. So the hair should be supple. It should have an even distribution. It should be thick. It should be dry. Moving on to the scalp, you're looking to make sure that the scalp is intact, that there are no lesions, any pests such as lice, that there are no tenderness on any areas of the scalp. Moving on to the cranium, it should be normal cephalic. It should be of a normal shape and size, and again, there should be no tenderness. Next, assessing the temporal artery. You can find that right here. On the side of the patient's head. It should be 2+ to 3+. It should not be bounding, and it should be palpable, should not be thready. Next, moving on to the mouth and throat. I'm looking at the lips. All areas of the mouth should be pink. Lips should be pink and dry, not overly dry and cracking, but you're looking for any excessive drooling as well. Next, I can ask the patient to open their mouth, and I can use a pen light here. To assess the tongue should be rough and pink. The mucous membranes should be pink and smooth around the tongue. Next, you're looking at the tonsils. There should be no discharge coming from those. The uvula, it should be midline in the mouth, and then upon asking the patient to say ah, you should see it rise symmetrically.